If you are constantly dealing with repeated fever, chills, headache, or body aches, even after taking anti-malarial drugs, this video is for you. We'll break down the 5 major reasons malaria symptoms return and what actions you can take to finally break the cycle. Make sure to watch this video until the end for essential recommendations that could save your health. Don't forget to like, share, and subscribe to our channel. Reason number 1. New infections. Reinfection is the number 1 reason people experience recurring malaria. If you live in or travel through malaria endemic areas, like many parts of Nigeria, every mosquito bite could simply lead to getting infected again. You are more at risk if you live in malaria endemic area with high mosquito populations. You are outside during mosquito feeding hours. You don't constantly use preventive measures like insecticide treated mosquito nets, and you don't apply mosquito repellent. Each case may not be a relapse, but rather a completely new infection. At our lab, we use microscopy, antigen test to assess parasite load and help determine whether it's a reinfection or relapse. Reason number 2. Incomplete or incorrect treatment. Many patients stop taking their medication once they feel better or use the wrong dosage. This can cause parasites to remain and multiply all over again. This is a leading cause of treatment failure. So what do you do in this case? Never stop anti-malarial drugs just because you feel better after a few dosages. Some parasites survive in your bloodstream. These remaining parasites multiply again with recurring symptoms. Incorrect dosage can be ineffective. This has to do with children. When dealing with children, you need to give them the right dosage for their age. Most times, the right dosage for their weight. Always follow the complete prescribed regimen. If you are unsure whether your medication or dosage is correct, talk to a healthcare provider. Reason number 3. Drug resistance. Anti-malarial drug resistance is rising, especially with the Plasmodium falciparum. This is the most dangerous malaria parasite. They have developed resistance to common anti-malarial drugs. This means that the medication that worked for you previously might not be effective anymore, allowing parasite to survive and cause recurring symptoms. Signs of resistance include symptoms returning after days or weeks, slow recovery despite the proper dosage. At Trafima Medical Diagnostics, our laboratory can help detect signs of resistance and work with your doctor to find effective alternatives. Reason number 4. Dormant liver stage parasites. Some malaria parasites like Plasmodium vivax, they hide in your liver as hymnozoids. They can stay dormant for weeks or months, and suddenly they reactivate themselves, causing new symptoms without any new mosquito bite. This is called relapse, not a reinfection. Regular anti-malarial drugs don't kill these liver stage parasites. This is the same thing that happens to a particular person that travels out of Nigeria. You stay in UK, you stay in US, you stay in Canada where there are no mosquito bites. But at a point, you start having symptoms of malaria all over again. This is what happened to you. There were some dormant liver stage parasites that stayed in your system. So while you travel out, after some weeks or months, they reactivate themselves. So what do? In such cases, you need to meet your doctor to prescribe a good drug for you that will target the liver stage parasite. But you need to get tested to know which species is affecting you. So wherever country that you are, if you are in Nigeria, you need to get tested to know which particular species is affecting you. Canada, anywhere that you are, you need to get tested first before you can take the anti-malarial drug that will target the liver stage. Reason number 5, wrong diagnosis. The fifth reason may surprise you actually. What you think is recurring malaria might not be malaria at all. Many conditions mimic malaria symptoms. Conditions like typhoid fever, viral infections, UTI, autoimmune disorders, and so many other ones. Without proper laboratory testing, these conditions are often misdiagnosed as malaria. Self-medication or presumptive treatment based on only symptoms leads to inappropriate treatment and continued suffering. At Rafima Medical Diagnostics, we use gold standard tests to confirm malaria, saving you from misdiagnosis and unnecessary medication. So what should you do if you are experiencing recurring malaria symptoms? Number 1, get tested before you start any malaria treatment. Complete your medications exactly as prescribed by your healthcare provider. Use proven preventive tools like insecticide-treated nets and repellent. Consider testing for other conditions if malaria is ruled out. Ask your doctor about liver stage treatment if you've had multiple relapse. If you are outside the country, the last option is also for you. Ask your doctor for the liver stage treatment. In conclusion, breaking the cycle of recurring malaria can feel like an endless loop. But with accurate testing, proper treatment, and prevention, you can break free. At Rafima Medical Diagnostics, we are committed to providing reliable testing that guides effective treatment decision. You can visit our laboratory at number 117 Oran Road, Uyo, or contact us via WhatsApp. In conclusion, breaking the cycle of recurring malaria can feel like an endless loop. But with accurate testing, proper treatment, and prevention, you can break free. Don't forget to like, subscribe, and share this video to help others who might be suffering from recurring malaria. Remember, proper diagnosis is the first step to lasting recovery.